living with type 1 diabetes. I've had it since I was 6 years old, and I'm very open with the fact that I've struggled quite a lot emotionally over the years with the condition, and so now I run a therapy and education service called Positive Diabetes, and also work for Central and North West London NHS Trust. Out of my experience of having great clinical care from my medical team, but not always feeling able to talk openly about the day-to-day emotional impact of living with the condition. And so I really felt that there was a space for people to get those issues addressed, and Positive Diabetes hopes to offer that space. And we have online resources in the form of blog articles and self-help articles that people can read and kind of hear experiences of how they might be struggling emotionally with the condition. And also we offer individual therapy, both in person and over the phone and by Skype. To empower people to live their best possible life with diabetes. Diabetes is tough, it's a condition that we don't have any break or holiday from, but also when we get control over our diabetes we can see that we can have agency in our lives, and we can have make quite powerful decisions about the course of our health and our well-being, and I really feel that getting in touch with how to better manage your diabetes enables you to be a better employee in your job, it enables you to be a better parent or partner, and I think that's a really exciting message that doesn't always get out there about managing a chronic long-term condition. It's often about what's difficult and what's challenging, and it is those things, but also it enables people to develop skills that they might not otherwise have developed, that then makes them kind of a bigger version of themselves, which is really exciting. Well, we know that depression and low mood are 2 to 3 times more likely to occur in people with diabetes. There's something about managing a chronic health condition which makes depression and low mood more likely to occur. Anxiety around diagnosis, around managing the needles and injections of diabetes can be a struggle. Fear of hypoglycemia means a lot of people run their blood sugars higher than they could do for optimal health. So there's lots of kind of diagnosable and classifiable difficulties, emotional difficulties that people can struggle with. But also I think there's a space for people being able to translate what the medical team help them with into their everyday life. So these are people that wouldn't necessarily come and see me as a psychologist with depression or anxiety, but they do have a HbA1c that's higher than they would like, but don't quite know how to figure out the day-to-day self-management tasks in the context of their everyday life, with its competing priorities of getting the kids to school or getting to work on time or whatever it might be. And I really see clinical psychology as providing that non-medical space outside of the demands of everyday life to problem solve together about how diabetes is going to fit in to that busy life full of priorities. And that's a message that I'm really excited to get out there with Positive Diabetes, and I hope that the NHS will move in that direction too. At the moment, there's not nearly enough of us clinical psychologists working in diabetes teams, and so the people, the patients that we do see often are those in a lot of psychological distress who might have classifiable mental health issues. So that's a really important role for clinical psychologists to play. But also I think there is this other piece about the self-management issue and how to create that space for patients outside of the medical setting, and that's where I really am passionate about moving the NHS in the direction of. And I really do have a dream, and that dream is that clinical psychologists are as integral to the multidisciplinary care of people with diabetes as their diabetes nurse, as their diabetes dietitian. I think every person with diabetes who wants to see a clinical psychologist should have access to that as a routine part of their care. We're a long way from that, But I think there's a lot of ideas about funding issues around psychologists. We're quite an expensive resource. But I think what gets missed from that conversation is how clinical psychologists provide patients with self-management skills that will last them their lifetime. And so actually the cost of a clinical psychology at the point of service needs to be offset against actually that person with diabetes having better controlled diabetes over the course of their whole lifetime. And I think when it's put in that perspective, actually it's quite a good use of NHS money.